So in this video we are talking about the interpretation principles. So number 1, we're going to talk about comparing what we see in a scan to a mental image of normal anatomy, and then second number is to look for the symmetry in our scans, and the third number is we're going to use a systematic approach to check out the combination view scan. So first is the mental image of the normal anatomy. You should know the normal anatomy so that you can differentiate between the normal and the abnormal one. There can be variation to normal, but this can be considered under normal only. So you have to know what is normal to know what is not normal. So here we see the mandibular canal of the patient from the sagittal view from the side. So this is, I would say, it looks normal. You know, the contours of canal look normal, and it looks normal in overall size and shape. And here is the variation of normal. Here we can see the mandibular canal is actually bifurcated. So is it pathologic? No, it is just a variation of normal. So if you want to be placing implants in this area, so it's not pathologic but just a variation of normal. So now this is the abnormal image. So here we see the mandibular canal that is actually looks dilated, and it looks enlarged in this one particular area. So we see the normal contours of the canal, and then it widens before tapering down again and having a more normal diameter. So this would be considered abnormal. So there is pathology within that location of the canal. So now we're going to look for the symmetry of the shape or size of the bone or the density of the bone. So we want to compare a patient's right side with their left side. So we can easily look for symmetry in axial and coronal view, though you do not have the ability to compare right and left sides in sagittal view. So cone beams actually, when you are reviewing, you should look at the axial and coronal views first, so you can look for the symmetry between the right and left sides, and save the sagittal view for the last one. Now this is an axial view. There is an asymmetry right there. So we can see this area which is low density or radiolucent, and we do not see it on the other side. So there's no lingual cortical plate, but actually the surrounding areas does look pretty well defined and looks like it has a nice rim of cortical bone on the inside, but again no lingual cortical plate. But we do see the lingual cortical plate on the other side. Now we are looking at the same case and the coronal view, and we can see there is something on the patient left side and not on the right side. So this is actually departing in the region of the submandibular gland, and so this is also known as Stephanie bone defect. And so it is most commonly found in this area, and it is thought to occur by pressure of the submandibular gland on the bone, and it actually forms a depression in the mandible. So this would not necessarily need to be treated other than maybe radiographic follow-up at the patient's next recall appointment. Now we have the 2D image of this case. So there is a radiolucency in the mandible. It does not look attached to the apices of these molars. Now the third one is the systematic approach. In this we review the patient information, whatever it is, like age and gender of the patient, and the clinical findings which are evident in the mouth. Then we review the CBCT global, like global to local level, and then we can search for the patterns, like for the symmetry or whatever we have discussed earlier in axial, coronal and sagittal sections.